The Dr. Fazil Show is brought to you by Health Tips Media. The Dr. Fazil Show is intended for health educational purposes only, and complies with all HIPAA regulations. Enjoy the show.
Hello, folks. I'm Dr. Fazil. You're watching May 2025 episode of Dr. Fazil TV show. I'm an internal medical specialist as well as a kidney specialist. So every month I try to bring up some new topics for your health and well-being. So the topic for discussion today is based on what is the most common encounters I get in my practice and the most common issues with the patients I see. One of them is actually the low back pain. It's one of the very common medical problem in the outpatient setup. Low back pain sometimes present with just a dull back pain in the lower back, which is the most common part of the back, or sometimes it comes with the pain shooting into the leg. So let's get some holograms while I'm doing all that discussion. It will make easier to understand. So we're going to bring some hologram about the lower back anatomy first. So here's the hologram, and we're going to hold it right here. As a matter of fact, a little bit on the side so I can keep it away from my face, so you can see it, right? So you can see this is the anatomy. This is the spine, and spine have vertebrae and then disc, vertebrae, disc, and then it has different actually sections. So let's bring it down a little bit. Now you can see we have the neck, cervical spine, mid back where the brow line is for females, thoracic spine, and the lower back or lumbar spine, right? And you can see from each side there's a little holes. We call it foramen. From these foramen you can see those yellow wires are coming out. These are the nerves, and they become like a bundle of the nerves, like electrical wires, and then they go all the way down to the leg. We call it sciatic nerve. But when you get actually a pressure point on those nerves, let's park this hologram right here on this side, and we can use it later if we need to, but for now we're going to park it here. So let's bring another hologram. Oh, it didn't come up. Okay, I think I have to pull it from the top. Let's bring it another hologram from the top. Oh yeah, it came up. Okay, so you can see this is just a more amplified anatomy of the spine, right? Disc, vertebra, disc, and the nerves on the side. So those little holes you can see, they can get tight by various processes. If the disc, you can see the disc. Now you can see if it is that much in a degenerated disc disease, degeneration of the disc. With time, the disc become less fluid and they become narrow. That's normal aging process. And then the space between the nerves become further, these holes or foramen become less, and they get easily pinched. If you do any heavy exercise, jumping, the nerves get pinched easily. That's common process. Sometimes the vertebrae, you can see also, I'm just trying to show you with this hologram. See, it's cracking. So vertebrae become compressed if you have bone disease like osteoporosis, and that can also cause the same process. The third option is, or third situation is where the fracture, there's a fracture of the whole vertebra. Can happen with the trauma, fall, but you can see that whole, now in this, I'm just keep changing the hologram. The whole vertebra is kind of crushed, right? Another option is, or situation is, the disc, instead of getting degeneration, have herniation, right? The whole disc is herniated. So it's not like a aging process, but it's just with some extreme trauma or normal daily routine stuff. I don't know whatever the people do, but if sometimes they end up having that disc herniation This is just kind of herniating. You can see this is herniating and touching the nerve. And when it touches the nerve, it will cause the patient to have pain going to the relevant portion of that nerve downward toward the leg, right? And the final cause of the pain is, there are other causes too, so we are going with the most common causes. So where there's a bone spurs, like, bone spurs, you can see there's these two vertebrae sitting on the top of each other on the side, right? Those are junctions. And those are the joints. And they can get arthritis just like any other joint you can get arthritis in. And that will develop bone spurs, and they can also cause compression or pressure points on the nerves, and that will cause pain. Now, in practical matters, generally I see most people have all of that at the same time. They have mostly degenerative disc disease, we call DDD, along with arthritis, sometime with, and that's the most common scenario. Arthritis plus a degenerative disc disease, and then disc herniation. That's a common scenario. Sometimes with we see bone fractures of the vertebrae, but that's kind of less common, right? So obviously, now you know why you get pain, right? You can get arthritic pain, and you can get radiation of the pain. Arthritic pain is generally localized at one spot only, but if you have pinched nerve, it will shoot down to your legs. We call it sciatica, right? Okay. So how you prevent it? Well, prevention is the more important thing. Well, don't lift your weight with your back, lift it with the knees. I can bring another hologram, and you can see, let's push on the side a little bit, and you can see here, this is how you are try to lift the weight with the knees instead of leg. So the pressure point is on the knees and the hips and not on your legs. So that's kind of like normal process. Also use a back brace if you're going to use some heavy lifting to prevent pressure point on your back. And the other thing is, now if you do get it, like how you fix it. So what happens is that when you get those inflammation of the nerves, they become swollen. So let's bring another hologram, and I'm going to put it here. You can see these nerves are inflamed and they get swollen. As they get swollen, they get more pinched. They get more pinched, they get more swollen. It's a vicious cycle. So what you do, a cortisone shot in that area will help to reduce inflammation. So eventually the pain will go away. If you avoid to not re-inflame the nerve, well, that's one option. And the second option is, and here's another hologram, and you can see that this is cortisone shots being given to that the point where the pain is coming from, and that will take away the pain. And eventually the pain will go away long term if you let the nerve heal. There are other medications like gabapentin or Neurontin or Lyrica, which you can also use to numb up the pain for a meanwhile. That's kind of like a easy way out, right? I'm talking about most common scenarios. Let's park this hologram on this side for now. Okay. Now, so what is the treatment? The treatment is, now if you already have it, what is the treatment, right? We said we can give gabapentin, Neurontin, cortisone shots, obviously, and the cortisone shots come in different fashions. For example, if you can get under the fluoroscope with a deep injection. Let's bring another hologram, and you can see the injection is going deep into the spine under a fluoroscope, right? And that's known as epidural shot. Or you can have a less deep shot, not into the spine, but around the spine, and that can also reduce the pain, and eventually pain will go away.
The Dr. Fazil Show is now available to view at home on Roku devices and YouTube. Catch up on your favorite episodes right on your phone, available on YouTube and the BioFamily Clinic app. The Dr. Fazil Show is available in many doctor offices across Yuma, Arizona. Pick up your free copy of Health Tips magazine, available throughout Yuma, Arizona, or read our digital version at healthtipsmagazine.com.
Other option is doing a physical therapy. And what you do in PT is that properly done, it can help by causing traction. If you do traction on the spine, you cannot do traction by manually. You have to use some real powerful machines to take the stress away from the back, so you can unpinch the pinched nerve, right? Unpinch the pinched nerve. So folks, that's what they do in physical therapy if it's done properly, right? Most commonly it is done, if it's not done properly, then it might not make any difference. So you have to make sure you need traction. Now, I'm going to tell you another trick. You can buy from some online stores like a very cheap belt known as decompression belt. Now I'm going to bring a hologram of this belt. You can see this is the belt. It has air pockets inside. So this is not your normal back brace. This is different. This is known as a decompression belt. Very cheap. You can buy for like $30 or $40 from online store. It works really well. Wrap around your back, and you can see if you pump the air into this, and you can see this pump, air is being pumped. The belt is getting bigger and bigger. So it's, if you put it properly on your back, and you use the hydraulic pressure of the air, it will kind of like when you, it's the same concept that when you have a flat tire, you can use a jack to lift up the tire off the ground. Same thing this belt does, that when you put it on your, where the injury is, if you wrap it around and if you do like pump the air with manually, it will lift the spine away from your pinched nerve and it will unpinch it. So you can leave it for 30 minutes, and then you will have the pain go away. And this is very useful. You can use it anytime when the pain comes back. You can even travel with it. Just don't sleep with it, just to be on the safe side. But yes, and it's a very cheap and effective way of treating pinched nerve, folks. There are other options too, but again, I want to keep it simple, practical. I mean, we're not talking about the surgeries, other pain options, pain management options at this time. Obviously, there's there are many other options. But one of the options I need to talk about that. So if you do have arthritic pain, so there's a nerve. Now let's bring another hologram right here. And you can see the vertebrae, like top vertebrae to second vertebra underneath with the disc in between. Those vertebrae have a nerve supply. So in certain situations when the doctor determines that your pain is from the arthritic pain, obviously the cortisone shots will help, but not that long. So what they can do is they can burn the nerve. We call it median nerve ablation, right? Median nerve ablation. So basically with the laser, they can go in, they can literally zap the nerve off. And that's what happens is then the pain transmission to the brain goes away and you will have no pain. Generally the nerve grows back in 3 to 6 months, sometimes longer. And then you have to have this procedure done again, but it's very effective treatment. A lot of patients who need to have it, if it's done properly, they have a more effective relief of the pain. So folks, those are the few tricks and tips for pain of your lower back and pinched nerve. So this is how you unpinch the pinched nerve, right, folks? So prevent it if you can prevent it. If it happens, you already have the pain, that's how you can do it. 80% of the time it will work, and 20% of the time then we have to take more aggressive measures, but that could include surgery and pain stimulating implant or more pain management, but we'll talk that in another session. Folks, on that note, it was Dr. Fazil show. It was my pleasure to have you watch this show, and we'll be back next month with more episodes and more important topic for discussion. So I think some of my audience, which has to be some robots, have some questions today. So Robot Eva, you have a question?
Hello, Dr. Fazil. Do you get the same effect for back relief if you hang from a pull-up bar? Or what is recommended?
Like a bar, like a in a gym. Okay, so it has two parts. The first thing is that yes, you can have some relief, like stretching. If you hold yourself from like a pulling bar and drop yourself downwards and try to stretch your back, it will help you to some extent. But there are two caveats in this question. Number one, as a matter of fact, Eva, you can come on the stage. Eva, our robot, please welcome our robot. Eva. Okay. So Eva, now she's here. So there's two caveats. One is that hanging with the bar is not that easy. Most patients, they don't have that kind of strength to grasp the bar and hang it, and they might fall and hurt themselves more. That's one caveat. If they do able to do that, then you have to, the body weight is not enough to stretch your back to the fullest extent. Remember, the spine is not a weak structure. It has a lot of ligaments and a lot of, it is very tough part of your body. So it would not just like stretch with a minimum pressure. So you need a lot of pressure to do that. So that would be possible, but not very effective. So that's why that decompression belt has a lot more effect because it is using hydraulic pressure, just like a jack for a puncture tire of a car. You can use a very little force and you can lift a heavy car. So that's why you either need a machine, a traction machine at a professional place, like a physical therapy to do that, or you can do it yourself at home. But hanging would be mostly not practical for our patients, and then also not very effective because of the fact that the anatomy of the spine is pretty strong to do that. But it might work, but not as much as you want it to be. So it was a good question, Eva. Do you have another question, Eva?
Yes, I do. Would the use of an inversion table or chair relieve the pressure in your back?
Again, that's a good question, Eva Robot. Thank you. So basically, the question was that if you're, let's bring another hologram here. Eva, you're gonna just stay on the side. So this is a hologram. You can see the patient is hanging up with the legs up and head downwards. It's commonly recommended and advised, but it's not very effective. Same concept. There's two problems with that. Number one is that you want to make sure that somebody is with you, because if you get stuck, it can cause problems. You know, you can pass out on that. You know, if you stay long enough on that and you are unable to come back on your normal position, right? Two, same thing. You have to have enough weight on the other side to cause traction. And again, hanging you're hanging upside down. So we'll give you some relief, but again, the spine is pretty strong for the inversion tables to work that much. So it's might be effective for just a muscle spasm, but if you have a severe pinched nerve, it might not help you that much. So my answer is yes or no, depending on the situation. But I think if you have to pick up between hanging from the bar, inversion tables, or decompression belt, I think decompression belt is a lot more practical and less side effect and more effective. So that's my question. Well, do you have any other question?
No, not at this moment. Thank you for the information.
Oh, Eva, okay, well, Eva, if you don't have any questions, it was nice seeing you. Have a nice drive back home.
I actually do not drive. I just teleport anywhere I want.
Oh, teleport. Oh, that even better. Less congestion on the roads. So have a nice teleport. Thank you. Bye-bye, folks. Thank you for watching Dr. Fazil TV show. God bless you. God bless America. Have a nice rest of the month.